Every year we do the Ghost Out program with a different school in Daviess County. Today's events is all about impaired driving. And when we talk about impaired driving, we talk about texting and driving, drinking and driving, drug driving, even prescription drug driving. Any type of medicines or substances can affect your ability to safely operate a vehicle. Interestingly, in Kentucky, 2 out of every 5 people will be affected by an alcohol-related event at some time in their life. 2 out of 5. So we start out at the high school. We do a mock crash scene. We have fire department, EMS, police all respond. The students don't know anything about it. Their parents do. They're actually put in these situations by the Grim Reaper, coming to their classroom and getting them, pulling them out of class. And once again, their parents are the only one that's really known about it. They all go to the scene. We dress one of them up in a tux, one of them up in a prom dress to make it simulate prom coming up for them. And we actually have them cut out of the car by the fire department. So the patients came to us by local EMS services. Once they get to the emergency department, the excitement for them really begins and the trueness of what's going on.
When we got to the hospital, my friends were laying there and they weren't responsive. It was really scary.
Cold chill on the belly, cold chill. You still with us? You still awake? You still with us? She's getting sleepy, Dr. Decker. I'm afraid
what's going on?
You might have to end up intubating. Yeah, I think so too. But
What's intubating?
We have our ER physicians, our ER nursing staff, trauma staff, and our trauma surgeon and trauma medical director all involved in acting out what really happens in a trauma.
It was almost too real. You really felt it in every stage of it, whether we're on the ground, we've just been ejected from the car, and then we're being put on the stretcher, going to be put in the ambulance, and we're on the way here, and we're like, are we going to even make it to the hospital?
Even though it was fake, you just couldn't help but think, what if this really happened to me? And what if this was my last day? And what if I took my last breath?
Did you not do everything you could?
Everything we could. There was too much. She was
No! Then fix it. You leave her and you go fix it. She is a child. Oh God.
Those events unfold just like they do for any trauma. The only exception is these kids are going to walk away today. Unfortunately, when patients come in like that, their outcomes are less favorable.
It's obvious that we make an impact on them. We see them crying. We have parents come in crying. They're remembering this and they're taking this with them. And if we can get 1 or 2 kids to not do something to put themselves in harm's way, then to me that's a huge success.
Once we're done here, the students actually have written a letter to their parents about what they learned today, and then acting like this is their last day, what would they say to their parents. Once we're done here, the police department will take them to the jail for a tour. They'll go to the courthouse and see how court goes, and then we'll end up with an assembly at Daviess County High School.
I'd love to see us reach out to young people across the nation to try to make them understand the dire consequences of making bad decisions like this.
I just think the Ghost Out program is so amazing and it's so important, especially in today's world, honestly, with everything that is going on, everything that teenagers are exposed to. This is information that people my age need to be exposed to because they need to know how serious their actions, like the repercussions of those actions, how big of a deal that is.
No! No!
And I'm sorry.